Welcome everyone. This is Alveoly E-learning. My name is MK Obin. I'm one of your course instructors at Alveoly E-learning. The main purpose of Alveoly E-learning is to make learning simple and easier for all students, irrespective of where you are. All you have to do is to get access to a mobile phone, a computer or a laptop with an internet. Then you just sign up to www.alveoly.com. Okay, then you just get your pen and paper. When you log in, you have access to various courses. Then with the course that you have your interest in or you have difficulties in, then you sign up to those courses. Alright, so as I was saying, the diaphragm is a thin layer of muscle that separates the thoracic cavity from the abdominal cavity. And the abdominal cavity houses the abdominal organs. However, these abdominal organs are within a sac known as what? The peritoneum. And the peritoneum, as we know, they have two layers, parietal and visceral. Then between the parietal and visceral, there is a space called what? Peritoneal cavity, where we have the fluid. So if the fluid becomes excess there, then it leads to what? An abdominal distension. Then we term it as what? Ascites. When this ascites occur, what usually happens is that it puts pressure on the diaphragm. So because there is excessive fluid accumulation here, when it puts pressure on the diaphragm, you see, it reduces the space in the thoracic cavity. So the lungs cannot expand fully. So patients who present signs of what? Or patients with ascites usually present signs of what? Difficulty in breathing. See, or dyspnea. So dyspnea occurs in patients with what? Ascites. Why? Because when they lie down, because of the excessive fluid accumulation, it puts pressure on the diaphragm, then it reduces the volume of the thoracic cavity. So the lungs cannot expand fully to accommodate enough air. So because of that, these patients are usually nursed in a high fowler's position or semi-fowler's position or in a sitting upward position, so that the abdominal content will come down, then the pressure on the lungs will reduce. When the pressure on the lungs reduces, then they are able to do what? Breathe very well. So patients with such symptom or such sign like ascites, you usually see them always in the sitting up or sitting in a chair or on bed. They usually can't lie down, because immediately they lie down, they realize that they start having what? Respiratory distress. So because of that, a procedure known as paracentesis abdominis is done for such patients to tap some of the fluid from the abdomen, so that when you are able to tap some of the fluid from the abdomen, it is going to reduce the pressure. When it reduces the pressure, it will cause the lungs to what? To expand well. Then now they will be relieved of what? Their difficulty in breathing. So now let's look at what paracentesis abdominis is. Okay. Mostly paracentesis abdominis usually appears in most of what? The nursing exams. So for us to understand it very well, what we are going to do is that we are going to delve deep into what paracentesis abdominis is and some of the nursing interventions that are usually very important in our next video. So follow us on our next video for us to understand more about paracentesis abdominis. Thank you very much.